Hello everyone, welcome you all to our new video about surgical instrument and their uses. At first, let's give a glance to the parts of surgical forceps. Here we can see it is the jaw, and after jaw there is box, and it is called the box log. After box log there is a long part of this forceps. It is called shank, and there is two round space for the for finger to accommodate, and this is called finger handles, and there is ratchet to position the forceps. After that, this is our first forceps, and it is called hemostatic forceps or artery forceps, and especially this type of artery forceps is called mosquito hemostatic forceps or small hemostatic forceps. This is called mosquito forceps because the forceps is very small, and we can identify by seeing the transverse group that are present in the jaw of this forceps, and there is ratchet shanks, everything are present. And now talk about what are the uses of mosquito forceps. First of all, we can use it to ligate appendicular artery during appendicectomy, hold small bleeding vessels. We can use it to hold cut edges of peritoneum. We can also use it to retract the cut edges of peritoneum and clamping of tube or catheter. After that, this is our medium-sized hemostatic forceps or medium-sized artery forceps. This is a little bit longer than our mosquito artery forceps, and it also has transverse serration just like our mosquito artery forceps, but here the jaw is a little bit longer than the mosquito artery forceps, and we can use it to crash the base of appendix during appendectomy, hold medium sized blood vessel or bleeding points. We can use it to hold the cut edge of peritoneum, fascia and aponeurosis, and we can use it as a tool for blunt dissection. Our next instrument is swab holding forceps, and as you can see, we can identify this swab holding forceps seeing its tip. Its tip has a fenestration, oval kind of oval shaped fenestration, and there are also some transverse serration present, and it is a much more longer than our previous artery forceps. And we can use our swab holding forceps to hold swab during antiseptic washing before any surgery, hold the fundus of gallbladder during cholecystectomy, hold the cecum during appendectomy, and hold vesical calculus during cystolectomy. Our next instrument is sinus forceps. It is very peculiar because look, it also has the transverse serration present, but it has no ratchet. In our previous instruments, ratchet were present. Let's look them back. It was sinus forceps, swab holding forceps. It has ratchet. It was our artery forceps, and it also has ratchet here. But in our sinus forceps, there is no ratchet, and we can use it in incision and drainage for an abscess in the site where there are important viral structure. It's called the Hilton's procedure. So we can use our sinus forceps in Hilton's procedure to drain any abscess, especially if the abscesses are located in face, neck, axilla, breast, and groin. Why we do Hilton's procedure here? Because in face, neck, axilla, breast, and groin, there are many vital structures present in this portion of our body. We can't just give an incision. If we do so, there is a chance that we may cut down many vital structures. So we just blindly dissect them. So in this procedure, we use our sinus forceps. Our next instrument is Moynihan's cholecystectomy forceps, and if we look at the forceps, we see it has a long body and the jaw is somewhat curved and the full jaw is serrated with transverse serration. We, as from the name, we can see it is Moynihan's cholecystectomy forceps. So we can simply guess what is the main use of this forceps. The main use of the forceps is cholecystectomy. As the forceps is very long, we can very easily hold the deep structure with this forceps. So catch the cystic duct and cystic artery in cholecystectomy. We can catch the pedicle of testes or thyroid during the operation. We can also use it in vagotomy to catch the trunk of vagus, and we can also use it in lumbar sympathectomy to catch the sympathetic trunk. Then it comes our plain dissecting forceps. So as their name implies, the forceps is used during the dissection, and many of us already have used this instrument in our anatomy dissection. We use the Babcock handle with Babcock blade in one hand, and another hand we hold this plain dissecting forceps, and in the tip we can see there is a plain transverse serrated line, and for this it is called plain dissecting forceps. So we can use it to hold delicate structures like peritoneum, gut wall, etc. Needle picking up in between the suture. We can use it for contact point in case of diathermy, and we can use it also in blunt dissection. And this is tooth dissecting forceps. It is just like our previous plain dissecting forceps, but look here, this tip has tooth. The previous one had a plain serrated surface, but this tooth dissecting forceps has no serration, but it has tooth in its tip. So this is why it is called tooth dissecting forceps, and it is used to hold the tough structures like skin, linea alba, scalp, fascia, and tendon. We can never use it to hold delicate structures like our gut, as we used them in plain dissecting forceps. We hold the peritoneum, gut wall using the plain dissecting forceps, but we can never use tooth dissecting forceps to hold the delicate structure like gut or peritoneum. But we use them to hold the tough structures like stated here. Then comes our Kocher's artery forceps, and you can see the at it is whole jaw is serrated just like our previous artery forceps, like mosquito artery forceps or medial sized artery forceps. But the peculiar point is that its top end is kind of having a teeth, and this makes it peculiar, and it is called the Kocher's artery forceps. So we can use it to hold vessel during operations like appendicectomy, mastectomy, thyroidectomy, and craniotomy. We can also use it to crush the base of appendix during appendicectomy, and we can also use it in obstetrical case like artificial rupture of membrane. Then it is Alice tissue forceps. Alice tissue forceps, as the name implies, we use this forceps to hold the tissue. Tissue are kind of tough structure, and you can see the Alice tissue forceps, at the tip of the Alice tissue forceps, it is toothed, and there is no serration in the part just below the tooth. There is no serration, and it always remains apart. We can use the Alice tissue forceps to hold structure just like margin of the skin, margin of the fascia, margin of the linea alba, and neck of the bladder. So as I said, all these are tough structure. Then it is our Babcock's tissue forceps, and just like the B-force, Alice tissue forceps, Alice tissue forceps had toothed end. But look here, this Babcock's tissue forceps, its tip is not serrated. It has no teeth in its tip. Rather, the tip is plain, and we can identify seeing two fenestration that is present in the tip. At least as it is tissue forceps, so obviously it is used to hold the tissues, but as it has no teeth, so we cannot use it to hold the tough structures. We always use it to hold the delicate structure, and in delicate structure we can never use the Alice tissue forceps, because if we use them, then the structure will be totally destroyed. So we always use the Babcock tissue forceps to hold the delicate structures, like uh, to cut, like to hold the cut margin of the stomach during gastrectomy, to hold the cut margin of duodenum, to hold the fallopian tube, and hold the vas deferens. All these are very, very sensitive, delicate structure. If we use Alice tissue forceps here, then the structure will be totally destroyed and we can never repair them. So we always use the Babcock tissue forceps here. Then it's our intestinal clamp. As the name implies, it is a clamp that is used in intestine. And look here, its jaw is very, very long, very, very long. We use it in many type of operation, but you should identify it seeing its oblique serration present in whole the line of the jaw. So we can use in case many operations that cause bowel obstruction, like interception, volvulus, and malignancy of gut structure. And we can also use it in any type of resection surgery, like hemicolectomy, transverse colectomy, or total colectomy. Then it is a two-in gastrojejunostomy clamp, or in other words, it is also called the Lane's clamp. It is it as its name imply, it is twin. That means there are already two forceps. You can see twin gastrojejunostomy clamp. Gastrojejunostomy. We use it in gastrojejunostomy operation or in Whipple procedure. So we can use it gastrojejunostomy operation, Whipple procedure, and gastrectomy. I want to say something about the Whipple procedure. We many of us know about the procedure. We usually do in it in carcinoma in head of the pancreas or periapulary carcinoma, where we dissect the whole en bloc dissection, do an en bloc dissection and remove the part of the duodenum, pancreas, and we directly join the gastric and jejunum by dissecting the duodenum. So it is called Whipple's procedure. Then it is proctoscope, and it has two parts. One is funnel or proctoscope. Using this proctoscope, we see the internal structure through the anal canal, and it is the obturator. So we can use this proctoscopy in many, many diagnostic cases, like internal hemorrhoid, rectal polyp, carcinoma of anal canal, carcinoma of the rectum, to take biopsy and injection, various kind of injection. And we can also use the proctoscope for polypectomy. This is kidney tray, and it is used to carry materials for dressing, stitch, cutting, etc., and to keep the dissected specimen like gallbladder or appendix. And it is gallipot. We can use it to carry this antiseptic solution, dressing solution, and we can also use this to keep the resected small specimen. Then come the retractors. They are also very, very much useful instrument in our surgeries. So first, it is Diever's abdominal retractor. It is curved. The surface is very much smooth, and it is usually used to retract the liver during any operation. So in cholecystectomy, we need to retract the liver. In cholecystolithotomy, in gastrectomy, in truncal vagotomy, in repair of perforated duodenal ulcer, in pancreaticojejunostomy, and in right hemicolectomy, and in nephrotomy. In all the cases, in all the operations, we need to retract our liver. So we use the Devers retractors. Then it is right angle retractors. All the retractors are very easy to identify. Just swing them. It has a two curved end at right angle of the shaft, and the shaft is having fenestration. It is used in herniatomy or herniorrhaphy or hernioplasty. It is also used in appendectomy or thyroid surgery. Main purpose of this right angle retractor to retract the structures. And this is Morris abdominal retractor. It is a thin long shaft and two retractor point at the two end, and it is used in just like right angle retractor appendixectomy and the thyroidectomy, and it is also used to retract the surrounding structure. And it's very cute cat's paw retractor, and its name is given because the retractor looks like the hand of cat. And that is our presentation on surgical instrument and their uses. Hope you have learned it and it has helped you. Thanks for watching.